It is exactly 9:18, exactly. News and views on Salam Media. Welcome to the second hour of the show. And we will now be talking with Dr. Angelique Coetzee. She is with the South African Medical Association. A very good morning to you, Dr. Coetzee. And of course, we're talking about something pretty serious this morning. It has to do with the shortage of doctors being at an absolutely critical stage in our country. What is the Medical Association trying to do to mitigate the situation, or are we too far gone as far as this matter is concerned?
Good morning. Yes, this is a very serious matter that you are discussing here. According to the World Health Organization, we need to look at around about 1 per 1,000 doctors. South Africa currently is sitting at 0.31 per 1,000 doctors. If we can trust those stats, it might even be lower. So the problem is an organization like SAMO or any of the other doctor groupings, we can make noise. But as you correctly said, I think this is the ship already sailed,
Mm.
and it's going to be extremely difficult to turn this Titanic around. But if you look at the World Health Organization, they want around about, as I've said, 1 per 1,000 in the next few years. And the average across the world at this stage is around about 3 doctors per 1,000. So we are very far behind due to various reasons.
Mm, mm.
There's
It,
quite a few reasons.
it's really disturbing, is it not? I know a short while ago, as you are also aware, regarding the incident with one of those government officials stating or telling foreign people in state hospitals that our system is overburdened as it is, and they are creating further problems by being in the country. Whether you agree with her or not, it is an issue that is further burdening the state system. That doesn't mean that we should be turning people away. Our doctors and our nurses are overworked. The situation in the country is very dire. People are not quite sure. There isn't confidence in South Africa at the moment, I'm sad to say, resulting in us losing very, very skilled, highly trained doctors and nurses. And I don't think the situation is going to get any better.
I fully agree with you. So if you look at the yearly graduation of medical students, it's around about 1,300. It's been stagnant like that for many, many years. We currently need more around about 3,000 medical interns per year, or doctors graduating per year. We need to look at that just to try to get this figure a bit more into perspective. Then again, if you look at the reasons, as you have said, one of the pushing factors is the lack of the lack of accountability, the corruption, the lack of confidence in the government, and the financial ability of the government, to ensure services being delivered. And the doctors are quite aware of that. And then again, the poor HR planning. So despite of all of this, we still have around about 20,000 specialist medical personnel posts available or vacant across 9 provinces. So, if you don't even fill those posts, how do you want these doctors then to stay in the country? As you correctly said, they are overworked and overburdened with the work that they are doing. But then again, there is no proper data on the type of patients that into the hospitals. They need to get that data correct.
Well, look, there's a lot of horror stories that come to mind when we talk about the state institutions. A couple of months ago, we heard about foreign trained doctors were barred from getting posts at state hospitals, and that I thought was a crying shame. They had to make a really big noise to make themselves heard and to try and get placements at hospitals. I know of two personal relatives or in my family circles who are battling to get posts as doctors, and they are South Africans, born and bred and trained in South Africa, and they couldn't get positions at state hospitals. And you kind of ask, the question is why? Why is there so much of red tape? Is it about preferential treatment? Is it about people high up wanting to get their friends and cronies into these positions? That's the one issue. And then, of course, and Dr. Angelique, there's also the issue about when you look at what happened at Rahima Musa Hospital with Dr. DeMeyer or Dr. DeMeyer, and just the poor state of our facilities. One, you don't have to play the guessing game to understand why doctors are leaving in their droves. So, what is the plan going forward to prevent this brain drain, this care skill from being lost in South Africa?
First of all, government needs to become more credible. We need to look at the provinces because a lot of these problems are lying on the level of provinces and not so much with National Department of Health. There must be a willingness from provincial departments of health to tackle this problem and to open up these posts, because the posts are, there are money available, but if you don't open the posts, if you've got an HR problem, there are studies done, there are recommendations that's been done, and nothing happens. And then accountability, because if you don't keep these politicians accountable, if you don't hold them accountable, then you can clearly see that it escalates down to chaos. And we cannot. And then another problem that we are seeing, is the hospice-centric training of these graduate students. They're very much hospice-centric. We need them in the private sector as well, and they struggle to get into the private sector. Their training is not sufficient to help them there. And we are sitting with another problem that's going to emerge within this next 5 to not even 10 years, about 5 years from now on. If you look at the average age of doctors, especially in the private sector, they are getting old. They are entering their 60s. They're going to leave. There's no succession planning. There's no urgency from local governments or provincial governments, as well as National Department of Health, to understand that we're moving into another red flag. And, if you think NHI are going to be only done by nurses, you're not going to get good outcomes going forward, because this is the work
absolutely not.
of pharmacists. This is doctors, and there's no succession planning. No.
Well, I dread the day, Dr. Coetzee, I dread the day that NHI, is introduced. And I know there's lots of talks behind the scene, but I dread the coming of the NHI. We can't get it right now. The system is already broken and they want to introduce NHI, but let's leave that for another conversation. You talk about hospital-centric doctors versus the private sector. What is so different there, Dr. Coetzee?
If you train your students, they are part of a team. So, if they can't figure out the problem, they can refer. They can refer up. They've got a team. But unfortunately, if you're not trying to be a generalist and you sit out in the private sector and you don't know how to do billing, the first thing is people are going to say you're corrupt, waste and fraud and abuse and all of that type of thing. But it's purely because they've never trained them. There was no proper engagement on how to do that part. Then once if you sit in your surgery and the patient is sitting in front of you with diabetes, hypertension, and HIV, then you have to bring the medication under one roof, and you cannot treat them as 3 different type of diseases. And it's not that easy. If you've not been trained, if you've been trained to look in a siloed approach to a patient, and you don't understand all the interactions with medication, and you're only used to the essential medical drug list from the public sector, which is most likely or most of the times at the level of the students, and nurses, not really uh, uh, um, preparing them for what is actually happening out there in the private sector. And then, in the private sector, also one of the problems is if you don't work, you're not going to get patients. If you don't have good bedside manners, you're not going to
Yeah.
get on
Mm,
your table. So there's a lot of things that we need to teach these youngsters
mm,
on how
mm.
to look after themselves, because government's not going to supply them with work after that, and they come serve.
So, Dr. Coetzee, what about, let's look at the two scenarios here. We're talking about a critical shortage of medical personnel, doctors especially. Your organization, the South African Medical Association, is saying that there's currently less than one doctor per 1,000 patients. Does that speak only to state institutions? Are we looking at a different scenario as far as private hospitalization and private practice is concerned?
No, this is not. This is in total. So in 2019, we had in South Africa 0.79 doctors per thousand. Now we are
Sure.
sitting on 0.31 per thousand. So it's dropping. The numbers are decreasing.
So
When
a
it
very dire situation indeed. Let's hope and pray that the powers that be start working and start working on a plan going forward. If not, we're not going to have any medical personnel left in our country. Um, do you see any light at the end of the horizon or the end of the tunnel, so to speak?
it all depends on political will. It all
Mm.
depends on whether we can sort the primary problems out. And we all know, what the problems are. Now, on top of it all, we now have the load shedding. We've got the water problem.
Oh,
We have personnel that went on strike in what that we have seen now in PE. It's unacceptable what is currently happening, and there's no political will. I don't see anyone standing up and say enough is enough. Let's sort this.
that's where we leave it on a very dark and depressing note. The issue around a severe shortage of doctors and other medical personnel in South Africa. Talking to us about that matter is Dr. Angelique Coetzee from the South African Medical Association. Thank you indeed for always being available to talk with us here at Salam Media. You go well, and let's pray the situation does improve.
That's all we can do.
Go well. Have a good day.
Thanks. You too. Bye.
Bye. 8:31 news and views right here on Salam Media. And that is frightening. It is scary. It's bad enough with the electricity and the water issues, but imagine not having enough doctors and nurses going around to service the country. It is frightening indeed. Let's hope and pray that common sense does prevail and that situation is addressed by the powers that be. 8:32 news and views. Standing by to talk to us is Koen Stoop, EU policy coordinator at the World Uyghur Congress.